Rapid urbanization in Nepal and Bangladesh is resulting into a burden of non-communicable diseases and increasing pressure on health systems. And health system requires timely and evidence-informed policy responses to deal with this kind of challenges. Media are key stakeholders of health system because they raise public awareness and also influence policy agenda through agenda settings. In this cross-country study conducted by early career researchers at Hard International Nepal and ARC Foundation and BRAC JPG School of Public Health Bangladesh, we try to examine the journalistic practices and news influence on health policy decisions. And this project was part of Innovation Fund scheme under CHORUS. This was a cross-country mixed method study, and our study found that health reporting both in Bangladesh and Nepal was rarely treated as a primary reporting bit within the mainstream news industry. Although health bit was gradually evolving, the health issues covered by news media outlets varied across countries. For instance, Bangladeshi media prioritized visible and immediate concerns such as traffic accident, waste management, air pollution, whereas reporting in Nepal mostly addressed healthcare access, infectious diseases, NCDs and environmental health. Journalists in both countries rely heavily on government sources for news gathering. However, Bangladeshi journalists perceived expert and research as more common sources compared to limited use of scientific evidence among Nepalese journalists. Journalism in both countries faced capacity gap in different areas, and these include limited knowledge on health issues, poor access to credible sources of information, political and commercial influence, and difficulty with health terminology and low wage. Our study found that journalists and policymakers in both countries perceive that news media influence health policy decisions, sometimes explicitly and sometimes invisibly. While media reporting shaped public discourse and created public pressure, evidence generated by news media was supplemented by other sources, for instance, government data and research articles. And lastly, our study recommends improved access to information for the journalist, strengthen capacity of the journalist, and enhance media and policymakers' collaborations.